Welcome, I'm John Caldera, president of the Independence Institute and your devil's advocate. Well, have you gone onto the site to get your Obamacare health care plan? Has it gone smoothly for you? Don't worry, it's just the beginning. To talk to us about it, Linda Gorman, who runs our Healthcare Policy Center at the Independence Institute. Glad to have you here.
Thank you.
Let's talk a little bit about the surprise over the website. And they're going to get this fixed, is my opinion, and they'll work it out because they'll just throw more money at it. What was the problem? Why was it so hard to get a website up to do what they promised to do?
Well, part of me wants to say it's just government and it's incompetent. But to be fair, they needed to integrate things like Medicaid and how much people have worked and state reporting on their income and the IRS. And since the government hasn't actually fielded any good computer system for the last 30 years, this was a pretty tall order. So from the news reports, they've messed it up all along the lines. The state exchanges are working somewhat better, but even they have problems because they have to interface with the federal government, and it's not happening.
People, if you're in this situation, you can go directly to an insurance broker, can you? I mean, if you're one of the individuals who's looking for health care, you can still buy it. But without this website working, you don't know if you get the subsidies. You don't know how to price the subsidies. You can't, that part doesn't work. There are people who are truly on hold until this mess gets cleaned up.
Yes, well, you can always calculate pretty much whether you're whether you're eligible for a subsidy. In fact, the Institute has a little subsidy, an explanation of the subsidy and how to calculate it on Complete Colorado, and also Kaiser Family Foundation has a subsidy calculator. So you can get an idea. But yes, if you're going to get a subsidy, the website is the only place that you can do it. And it's only, well, right now it's everybody, but there's a legal challenge to the federal government being able to offer subsidies through the websites that it runs in the various states, because that wasn't in the law. The law specifically says the subsidies can only be offered through state exchanges. They just passed an important court test. It'll be interesting to see where that goes. If in fact the plaintiffs win, then only subsidies will be available in state exchanges.
All right. Will you agree with me, sooner or later, this technical problem with enough money and enough people whining is going to get fixed? If it gets fixed by the end of November, great. If it gets fixed by the end of April, whatever, at some point it's going to do 99% of what they promised it would do.
Well, they'll get people enrolled. We've been enrolling people in Medicaid for 60 years, well, not 60, 40, with pencil and paper, and then finally bad computer systems. So yes, people will get enrolled, and in some sense it will work.
All right. What I want to talk about is some of the great things politicians say. I remember a guy said, "I am not a crook," and he was. I remember another president saying, I did not have sexual relations with that woman, and he lied. My favorite promise of read my lips, no new taxes. And if you like your health care plan, you can keep it. No one, I like that word, no one is going to take it away from you. But even Colorado's own Congressman Cory Gardner got his letter from his insurance company saying, because of Obamacare, we can no longer offer the policy you have. We are canceling your insurance policy at the end of the year. Did anybody see this coming? Did anybody see that promise was an empty promise?
Well, yes.
Yeah. People actually read it.
I mean, yeah, they estimated that 93 million people would have their policies changed, would lose their existing policy. I mean, that was the whole goal of the law. They want everybody to not have the kinds of policies they have today, and instead everybody's being forced to buy big corporate type policies. When
you say big corporate type policies, what do you mean?
You go work for a large company in the past anyway, not so much now going forward. You used to have a low deductible, and they covered all kinds of things. They covered eyeglasses, they covered dental care, they covered, down to a $500 deductible. That's what I mean by a big corporate policy. Nationwide network. And these were very lush and expensive policies because they were paid with before tax money. I mean, the biggest problem in U.S. healthcare for a long, long time, and it still is that if I buy an individual policy, I buy it with after-tax dollars. And if I get my health insurance through my employer, I buy it with pre-tax dollars.
How did it turn out that way?
It was an accident. During World War II, with wage price controls, employers started trying to entice employees by saying, okay, yeah, we can only pay you so much, but here we'll add on a health benefit. And about 1950, early in the 1950s, the IRS said, okay, that's allowable under tax law. And that was the way it was ever since. And that's why the U.S. developed a mostly employer-based health insurance system, because it's about 30% cheaper.
Because you're not paying taxes.
You're not paying taxes before you buy the health insurance.
You get to deduct it off your taxes,
Right.
basically. All right, so let me kind of go backwards in time. I have life insurance. I don't plan on filing a claim within the next year. I swear to God, I'm not planning that. I hope I don't have to. I've got home insurance. I'm hoping not to file a claim. I don't want to file a claim. I got car insurance. I don't want to file a claim. I can guarantee you I have no plans to file a claim. I have health insurance, and I guarantee you I will be filing claims next year. I guarantee you I will be asking for money out of this policy. Is that even insurance at that point? Because insurance is something you don't ever want to touch because some really bad stuff has happened. Someone died, someone got hit by a car, your house has been ripped apart by a tornado or a flood. You don't want it to happen. The compensation isn't worth the event. But with health care, I feel very differently. You know, I want coverage right now. I'm going to go see the doctor.
Really?
I'm going to have I want the coverage.
You like to go see the doctor?
Well, actually, I've got a sick kid, so my deductible goes like that.
Well, yes, and you're probably in the top 1% of spenders nationally, right? Mm-hmm. Or even, I mean, for example, Cover Colorado was the health insurance available in Colorado for people who were uninsurable because they had pre-existing conditions. And average spending per person was $11,000 or $12,000 there. So that's a high spender in health insurance. So you have a child who needs a lot of care. So you're one of those people who, you know, is out there. But the rest of us are trying really hard not to visit the doctor. We're trying so hard that you have all these, wait a minute, you have all of these academic ivory tower types moaning that we're not getting enough recommended care. I mean, they're always going around and complaining that adults are only getting 50% of recommended care. And then they complain when we go, and so we have to have Obamacare.
But when you go to the doctor, it costs $20. That's what it is. So go and see the doctor.
When you go to the doctor.
It's a piece of cake.
When I go to the doctor, it's $150. I have a high deductible policy, yeah. So I take care of the first $7,000 of expenditure, period. Or I did until Obamacare came along.
You mean you can't keep the policy that you liked?
I have a well, I'm a health policy wonk, and so I knew about the grandfathering, so I have a grandfathered policy.
Nice.
So until my insurer pulls out of the state of Colorado, which I hope they don't do.
But my point being, we as consumers, Americans as consumers, we get used to getting money out of healthcare right away. The analogy would be if my car insurance paid for my oil changes, and I put in $1 and they put in the $50 for my oil change, and therefore I'd be using it right away. Why don't we see health insurance the way that it was meant to be, health insurance, and why do we keep calling it insurance when it's not? It's a payment plan.
Well, it depends on how you're buying it. If you're buying it through a health plan, which would be something like Kaiser, there's even two huge regulatory structures. There's one regulatory structure for a health plan, which would be like an HMO, where you promise to pay them so much and they promise to take care of all of your health care. That's a health plan. Health insurance is a little bit different. It's typically medically underwritten. They quote you a premium based on what they think your expected health costs are going to be. So if you're ancient and creaky like me, they quote you a whole lot more than they quote for my 20-year-old daughter. If you have a chronic condition, they'll either waiver it, meaning they say we're not going to cover any expenses related to it, or they're going to charge you enough so that after you've paid, then your expected health expenses are pretty much like everybody else's. Now, what people don't understand about the individual policies is people who are spending their own money are buying individual health insurance policies, typically. Sometimes they buy health plans, but a lot of them buy health insurance, especially in Colorado.
Which is much more like the car insurance.
Which is much more like car insurance. And in fact, what they spend is much, much lower. They spend about 15 to 20% less than people who have this $10 copay, big corporate type insurance policy. And we find even in Medicaid, when you do that, Colorado had a phenomenal experimental program. It's called CDAS, Consumer Directed Attendant Support, where patients on Medicaid who needed personal attendants because they were paralyzed or whatever, Medicaid would figure out how much they were going to pay for it anyway, and then give them a budget. And then they could go out and hire their own people and use this like a debit card or something.
In other words, they had an incentive to save money because they got to keep what they saved.
And the incentive was they got to keep 50% of what they saved. So they saved 20 to 30%. So it's just wrong, A, to have the kind of insurance that Obamacare is foisting on us because it increases health utilization and makes people waste left and right. And B, it doesn't provide good care.
All right, let's get back to the policies for a second. So all these people, potentially up to 16 million, are going to lose their coverage, the coverage that they have now. It's going to change. But the president is on the stump saying, you're going to get a much better plan. Yeah, so the answer is, wait, I thought you said I could keep, you're going to get a much better plan. You're going to be happier with this plan. Is it a better plan? And what if you still wanted your old one?
Well, if you still wanted your old one, you're out of luck because the pointy-headed people in government say that they know better than you do. They also have said, because of the individual mandate, that you should feel comfortable paying roughly 10% of your income for health insurance. Well, actually, the affordability thing is 8% of your income for health insurance. So we go from people saying, whoa, I can barely pay my rent, to the government saying, okay, forget your rent. First thing you got to do is pay 8% for health insurance. As far as the plans being better, one of the plans offered in the Colorado Health Exchange consists of Denver Health. The network is Denver Health. That's one hospital, 8 clinics. That's what you get when you buy that plan. Now, is that a better plan? I don't think so, because when I make my choice about health insurance policies, one of the things I consider is if I come down with a really bad, rare disease, can I go see some of the best people in the country with my insurance? And I look for that very carefully. But again, it depends on what you like. Usually under Obamacare, the deductibles are higher, the co-insurance is much higher. When I buy a policy, I want to know what my financial exposure is. That's why I picked a $7,000 deductible. I pay that much every year. The insurer takes care of everything else. There's no copay. There's no double jeopardy about the network.
But you pay everything beforehand.
Right.
By the way, I have the same policy.
Actually,
I just
you just hit the deductible every single year.
One year, this was what was great about having a special needs kid. I hit my deductible January 11th. After that, I didn't have to worry about a thing. Hang on, I want to see the doctor about this. And what happens is you lose any incentive to conserve. Right. Because you don't shop around. And for maintenance things, getting women getting a mammogram, a colonoscopy, whatever these things that you're supposed to get, when you shop them around, actually you can save a lot of money. You can save a lot of money.
Yes.
But once you meet that deductible, or under Obamacare, what incentive do you have?
None.
None.
And of course, remember, you're a rare case. You're about 5% of the population at your spending level. So most people will shop around with that size deductible.
Once they get the website working, and they will, once people calm down because they've lost their favorite one.
Let's not glide over that so quickly. There's been a lot of damage done to a lot of people. I mean, the stories, one of the things that annoys me so much about this is there are people being hurt. If you have had a plan, you've been covered for a while, and all of a sudden they say, well, you've got to go to the Obamacare plan, like you've maybe been in Cover Colorado, and they say you've got to switch out. And about 30% of the people in Cover Colorado will be eligible for subsidized insurance under the exchange.
And again, for people who aren't there,
sorry,
Cover Colorado was Colorado's high-risk pool,
yes,
which actually worked really well,
yes,
which was if you have a condition that you cannot get an individual policy because of your condition, the state has this subsidized insurance program, and it is insurance, and the rest of us who buy insurance policies, there's a fee and it goes into that, and it really worked out well. Mm-hmm. And so if you had a condition that made you uninsurable, you were guaranteed you could get insurance here.
You could get insurance.
Right.
Yeah. So So if you were in another state, like some of the states where they've just canceled all the individual policies, there have been stories of people who have medications that cost $1,500 a month, or stories about people who, since they were diagnosed with cancer, they've been seeing the same doctor. All of a sudden, they're told, no, you can't do this anymore. You've got to go to an exchange plan. Well, let's assume you could sign up for the exchange plan and everything was fine with the website. All of a sudden, all of these networks, these health practitioners that you've developed trust with, you can call on the problem, you've got a good relationship, they're gone. Or you have to figure out how to pay for your medication while you're waiting for the website to get started. This is not treating people well. This is not looking out for the patients. This is government being government. It's not here to help you.
All right, let's go through this. They fixed the website. Everyone goes through that transitional problem that you just described, which really does hurt people, and I know what it's like, especially when you have somebody in your family that needs a lot of special medical attention. It's just, if you're moving from plan A to plan B, oh my God, it's nightmarish.
A chunk of your life.
Right.
Yeah.
All right. But let's say you get through that chunk of your life, and now you finally conquered the next bureaucracy, and finally you're figuring out how to get the drugs you need and all the rest. Then there won't be any more surprises. Then people will realize this program works, and Obamacare will do what it was promised to.
And Nancy Pelosi will be happy, right?
Right.
I have a list. I brought a list.
All right, so let's put on your crystal ball. What's the next little gift Obamacare is going to give us?
I think the Medicare cuts are going to be a big deal, because what's going to happen, they're cutting Medicare reimbursements. The only thing government knows how to do in controlling healthcare costs is to deny care to people by rationing somehow, or cut reimbursements to providers. And what's happening in some states, well, first of all, hospitals are shedding a lot of labor in anticipation of those cuts. And Medicare Advantage, which is the Medicare program where it sort of acts like an HMO, you buy into a network, and a lot of people who are lower income are enrolled in it because it basically promises to take care of all your drugs and everything. You don't have to worry. So they like it. They get better benefits. Those organizations are slashing their networks as well. So all of a sudden, a lot of people who are elderly, who maybe don't navigate the healthcare system very well, don't navigate in general very well, are going to find that their Medicare coverage is terrible.
To make this simple enough for me to understand, the feds reimburse Medicare, right?
Doctors.
They pay the doctors. And so what they're going to do is say, instead of paying you $100 for that procedure, we're only going to pay you $80 for that procedure. And so tell me if my economic incentives here are off.
It's not hard.
Why would a doctor have any desire to take on Medicare patients if it's going to become more and more charity work, and they're not going to get the money that they would if it was a younger person?
The ones that can leave will. I mean, there are a lot of practices now, unless you've been with them for a long time, if you're on Medicare, they won't take you on. But some physicians, a lot of physicians are specialized in diseases that mostly affect people who are of Medicare age. And so there's a limited private practice for them right now, because some people will just pay cash, but it's really pretty small. They have a tough time of it. If it gets bad enough, I think a lot of physicians will punch out, because the only docs I meet that are happy are the ones that are taking cash.
Right. So in other words, if I'm a young doctor, I'm thinking, well, should I go into Alzheimer's work, where I'm going to be dealing with helping the elderly as they get dementia and other things, or should I do sports medicine for
dermatology,
dermatology, or to help the kids with their zits? Where am I going to get paid? Well, you're not going to get paid helping the elderly. You have a better chance of getting more money as an income, taking care of the kids.
But the problem is Medicare controls the residency slots. So if they don't increase the residency slots, you can't pump out more of one kind of doctor.
Let's talk a little bit about this penalty. I know several people who are going to be paying the penalty. They go, it's $95. I'm going to pay the penalty. How long does that last? Because the whole scheme depends upon younger, healthier people paying into this pool to pay, isn't it?
No.
No?
No. But how long will the penalty last? The penalty will last until people think it's more expensive to
I mean, they're going to raise the penalty.
The penalty goes up to 2% of your income.
But Obamacare depends upon younger people getting
No.
into the system.
No. Obamacare, see, that's thinking of Obamacare like it's a private insurance plan. It's not. It's government run. It's supported by tax dollars. The only reason it was important to get the younger people in was the idea was, well, all these people are going to be paying these insurance premiums, and so over the 10-year CBO study, it looks good. Okay? But think about a younger person coming into an exchange. He doesn't get a different premium depending on his health status. What drives people out of private plans and creates this death spiral that everybody talks about is if they set the price wrong, younger people leave, then the average expenses in the pool is high, so they raise the premium, so more people leave. So pretty much what you have is a sickness pool, and it's worth it to buy insurance only if you think that your average costs are going to be higher than the
Right.
group. And that's called the New Jersey premium, because New Jersey's had that for years, and New Jersey hasn't gone broke or anything else. It's just you don't buy insurance. So that is the problem that Obamacare faces, not so much sustaining the exchange plans or anything else.
What's the next thing that's going to happen?
Oh, I don't know. I think that security on the data in the exchanges is going to be a big problem. I think the electronic health records are going to be a disaster.
You're going to tell me that we're going to have a problem with privacy when it comes to government data?
Healthcare? Oh, no. Just because the Colorado DMV lost,
Explain that.
lots of records.
Yeah, the DMV loses records. Yeah, so but they're going to be fine.
Well, as everybody's pointed out, the exchanges are an identity thief. It's what they dream about at night, because you have to basically apply for Medicaid before you can get a policy in the exchange. And to apply for Medicaid, you have to give all sorts of information about your family. And then they have to check who you're employed with, because they have to see if your employer offers affordable coverage. And then they have to check with your tax return to make sure that you're okay. So you have all of these people, these navigators, who have no background check or anything, helping you through this process, and it would be easy to harvest data in that process.
I love the term navigator. It reminds me when you go to the Apple store, and there's some pimple-faced kid behind the counter, and he's the genius.
Well,
that
he is,
you bring
probably
your
in that
thing to,
case.
and you say, hey, fix this.
Fix
and
this.
we're not too sure exactly what he does, but he helps do
But it
this.
works.
And he asks you for your blood type, social security. Yeah, now it's fixed. But these are the navigators that are going to pull all this stuff together.
Well, they're going to help you. They're not allowed to advise you. Basically, this is a big payback for all the nonprofits that helped get Obamacare passed, if you want the cynical view. But these data aren't well protected. In fact, the health.gov website had to get a special security certificate because it flunked the security checks. So you wouldn't even have to go to the problem of being a navigator. You could sit in Ukraine or somewhere and just hack the whole site and be done with it.
Keep going.
Yeah.
More predictions. Let's just see what we get.
Other things. Things are going to get very big. We have these accountable care organizations that are hooked up with hospitals. Basically, Obamacare puts hospitals in charge of the whole system in some sense. And that means historically that prices have gone up and everything gets pretty, fat and happy. And you won't have your own doctor. You'll be doing clinic medicine, meaning you go and you wait and you see whoever's available kind of thing. Prices are going to keep going up for health care because of all the taxes.
Now,
Lots of taxes.
Wasn't the promise that this was going to save the average family $2,500 a year? And everyone right now is taking a look at their paycheck, taking a look at these costs. I don't think people are buying it.
I think they're finally starting to see what the real costs are going to be from this. And these are subsidized costs. Yeah, it's very expensive. These policies are very expensive.
I'm almost wondering, I praise the Republicans for standing up and saying we need to defund Obamacare. And even when they said we're not going to fund the government until we do this, A for effort, all right? A for the right thing. In retrospect, wouldn't it have been better if they just said, you know what? Let's just bring it on.
No, because
so you can see what you got, and that's what we're finally getting right now.
Huge amounts of damage have already been done. For example, in many states, people have had their insurance policies canceled. These are pools that built up over decades. These are ways of doing business that built up over decades. They are gone. It's not like you can simply wrap the tape back and find a pool of capital that will do this again. So you're destroying things as this goes through the economy. It's not good to let it ride. I understand well, you voted for it, let's see it. But No, what we really need to mitigate the damage. The only way you mitigate the damage is to get rid of this, because there is no good part about this law. From my perspective, I just wish people would stop listening to people who obviously are lying to them. You know, just let's start there. Let's go back and look at who was right about predicting this, and then when we go talking about how to replace it, let's talk to those people.
We've got only 2 minutes left. Talk to me about replacing it. Let's assume this continues on, costs go spiraling, taxes go spiraling, we have the same problems, and we're starting to get worse service from our healthcare system. What do you think the fix is going to be?
The fix from the people who predicted the disaster, or the fix from the other people?
From
my perspective, what would I do?
You get to fix it.
I'd start by block granting Medicaid, because right now Medicaid is set up so that states race with the federal government to see who can spend more. It's ridiculous. We have a hospital tax, probably illegal, on our hospital bills in Colorado, simply because the state wants to maximize its Medicaid payments from the federal government. That's just wrong. We should do what we did with welfare and block grant it. We should get rid of the individual mandate, okay? Get rid of the requirements for electronic medical records, get rid of all of the oversight, and move Medicare to some sort of premium support plan like Paul Ryan was talking about. And then we should let insurers offer whatever kind of policy people want to buy and equalize the tax treatment between employer-provided insurance and individually purchased insurance. And if we did that, plus get rid of a whole bunch more medical regulation, things would start to look like an actual market as opposed to this fake one we've had for the last 40 years.
Would people with pre-existing conditions still be able to get coverage? And I
Yes.
understand that. Only got about 10 seconds. How would
Yes,
you do that?
well, they already could before, because states by federal law are required to provide an insurer of last resort, either a high-risk pool or an insurance policy. But there are other ways. Perhaps you buy health risk insurance such that when you want to change plans, somebody else pays.
We have plenty of time to talk about it. Linda, thank you. Thank you. Listen for me on KHOW Radio at 6:30. Tell a friend, and we'll see you next week.